Hello and welcome. Today, we're diving deep into a common, yet often misunderstood, kidney disease, IgA nephropathy, also known as Berger's disease. This condition primarily affects the filtering units of the kidneys, called glomeruli, and can lead to a gradual decline in kidney function over time. We'll explore what causes it, how it impacts the body, and what can be done to manage it. Let's get started on this important topic. The exact cause of IgA nephropathy remains a mystery, but scientists believe it's a complex interplay of genetic predisposition and environmental factors. It's not directly inherited in a straightforward manner, but having a family history of IgA nephropathy or other kidney diseases increases the risk. The condition involves an abnormal immune response, but the specific triggers for this response are often unclear. Potential environmental factors being investigated include infections, certain medications, and even exposure to gluten in some individuals. However, more research is needed to pinpoint the precise triggers. At its core, IgA nephropathy is characterized by the buildup of immunoglobulin A, or IgA, antibodies in the glomeruli. IgA is a type of antibody that plays a crucial role in the immune system, primarily defending against infections in the mucous membranes, such as those lining the respiratory and digestive tracts. In IgA nephropathy, for reasons we don't fully understand, these IgA antibodies form abnormal complexes that get trapped in the glomeruli. This deposition triggers inflammation and damage to the glomeruli, impairing their ability to effectively filter waste and excess fluid from the blood. Over time, this ongoing damage can lead to scarring, also known as glomerulosclerosis, further reducing kidney function. IgA nephropathy is one of the most common forms of glomerulonephritis worldwide. Its prevalence varies geographically, with higher rates observed in Asia, particularly in Japan and Singapore, and in Caucasian populations compared to African populations. It typically affects young adults, often presenting between the ages of 16 and 35, but it can occur at any age. Men are affected more frequently than women. The exact number of people affected is difficult to determine, as many cases may go undiagnosed, especially in the early stages when symptoms are mild or absent. The symptoms of IgA nephropathy can be subtle and develop gradually. One of the most common signs is hematuria, or blood in the urine. This may be microscopic, detectable only through a urine test, or macroscopic, causing the urine to appear pink, red, or tea-colored. Hematuria often occurs after an upper respiratory infection, such as a cold or flu, or after strenuous exercise. Another common symptom is proteinuria, or protein in the urine, which can also be detected through urine test. Over time, as kidney function declines, individuals may experience swelling in the legs, ankles, or feet, known as edema. High blood pressure is also a frequent complication. In advanced stages, symptoms of kidney failure, such as fatigue, nausea, loss of appetite, and shortness of breath, may develop. Diagnosing IgA nephropathy typically involves a combination of tests. A urine test is crucial to detect hematuria and proteinuria. Blood tests are performed to assess kidney function by measuring levels of creatinine and blood urine nitrogen, or BEN. A kidney biopsy is the definitive diagnostic test. In this procedure, a small sample of kidney tissue is extracted and examined under a microscope. The biopsy reveals the characteristic IgA deposits in the glomeruli, confirming the diagnosis. Other tests, such as blood pressure measurement and evaluation for underlying infections or autoimmune conditions, may also be conducted to rule out other causes of kidney disease. While IgA nephropathy is generally considered a single disease, its severity and progression can vary significantly among individuals. Some patients experience a relatively benign course with minimal kidney damage, while others develop progressive kidney failure. Pathologists often classify the degree of glomerular damage seen on kidney biopsy, using systems like the Oxford classification, also known as the MEMI-SC score. This score assesses the presence and severity of mesangial hypercellularity, endocapillary hypercellularity, segmental glomerulosclerosis, tubular atrophy, interstitial fibrosis, and crescents. The MES-C score helps to predict the prognosis and guide treatment decisions. There is no cure for IgA nephropathy, but treatment aims to slow the progression of the disease and manage symptoms. The specific treatment plan depends on the severity of the disease, the level of proteinuria, and the presence of other complications, such as high blood pressure. Angiotensin-converting enzyme inhibitors, or ACE inhibitors, and angiotensin receptor blockers, or ARBs, are commonly prescribed to lower blood pressure and reduce proteinuria. Immunosuppressive medications, such as corticosteroids, may be used in some cases to reduce inflammation and suppress the immune system. However, these medications have potential side effects and are typically reserved for patients with more severe disease. Lifestyle modifications, such as limiting salt intake, maintaining a healthy weight, and avoiding smoking are also important. In advanced stages of kidney failure, dialysis or kidney transplantation may be necessary. Unfortunately, there is currently no known way to prevent IgA nephropathy, given the complex interplay of genetic and environmental factors that contribute to its development. However, adopting a healthy lifestyle, including maintaining a healthy weight, controlling blood pressure, and avoiding smoking, can help protect overall kidney health and potentially slow the progression of kidney disease in individuals who have already been diagnosed. Early diagnosis and management of associated conditions, such as infections, may also be beneficial. If you have a family history of kidney disease, it is important to discuss your risk with your doctor. The prognosis of IgA nephropathy varies considerably. Some individuals may experience a stable kidney function for many years, while others may progress to end-stage renal disease, requiring dialysis or kidney transplantation. Factors that are associated with a worse prognosis include higher levels of proteinuria, high blood pressure, and more severe glomerular damage on kidney biopsy. Recent research efforts are focused on identifying the specific genetic and environmental triggers for IgA nephropathy, as well as developing more targeted therapies. Clinical trials are underway to evaluate the effectiveness of novel immunosuppressive agents and other therapies that may help to reduce IgA deposition and slow the progression of kidney damage. Understanding the underlying mechanisms of IgA nephropathy is crucial for developing effective treatments and improving outcomes for patients with this condition. Ongoing research continues to offer hope for the future.